Hi, I'm Dr. Puja. The CDC just announced that masks are back. I'm a doctor and I'm going to give you 4 best practices on how to get the most out of your mask. Look, the CDC is now going to require many Americans to wear masks indoors when they're in social settings. I want you to know that this decision is based on science and on evidence. So I don't want you to believe other people who are very confused, who are going to tell you that masks are not necessary. You need to know that masks are necessary because the Delta variant is very contagious and very dangerous. So if you're out of your home and spending time in outdoor settings, like going to the mall, going to the gym, or grocery shopping, it's time to re-mask. Children K through 12, everybody needs to wear a mask. Towards the end of this video, I have some positive steps that you can use to get little children to wear masks. Okay, so the science that you need to know, and I'm going to make this really simple and basic, is that if you're vaccinated and you get COVID, you still then can spread COVID to other people and make other people sick. I have another video where I talk about how vaccines are effective against the Delta variant. The link's below. Since it's been a minute and the Delta variant is spreading like crazy, both vaccinated and unvaccinated people need to wear a mask. Protection is prevention, and prevention is protection. I just might get a t-shirt made out of that. Okay, so this person does an excellent job at showing you how you should wear your mask and how you should not wear your mask. So I'm going to kind of walk you through it. Let's take a look at it together. Okay, so the first thing that I want you to see from her video is you need to cover your nose and you need to cover your mouth. So the best way to do that is to cover the bridge of your nose and then make sure that the mask is fitting nicely underneath your chin. That's good mask etiquette. So the first thing not to do is you don't want your nose exposed. You are breathing out and breathing in all of these coronavirus particles when you do that. So don't do that. And the second thing is you don't want your chin uncovered either. Yes, this covers your mouth and it covers your nose as well, but so it then becomes very loosely fitted over here and you're losing all of that air that you're breathing in and out, and it's going out of your mouth, it's going through the mask, and it's really not effective. So make sure that you're covering your chin as well. The third big no-no is you don't want that mask to just rest underneath your chin like that. You're exposing yourself to a lot of infectious particles when the mask is there. I mean, again, you're wearing that mask to prevent from catching the coronavirus, and you're wearing it also to prevent spreading the coronavirus. So again, don't put it underneath your chin. I know it's difficult. A lot of patients do have a hard time wearing masks, but it's super important that you do wear it in the correct way. Okay, so the second best practice is about cloth masks. A lot of people ask me about cloth masks, and the answer basically to the most common question that I get about cloth masks is yes, you can without a doubt wear cloth masks, but make sure that if you do, that it at least has 2 layers to it. Because remember, prevention is protection and protection is prevention. So the third best practice is about face shields. You cannot replace your mask for a face shield. Masks are greater than face shields, and they're not the same as face shields. Okay, and the fourth best practice is something that actually a lot of people don't believe when I tell them, is that your child, if they're 2 years or older, they need to wear a mask. I know it's difficult, I know it can be really hard, but the easiest way that I've found is if you start practicing wearing the mask at home and kind of making a game out of it, kids absolutely love it. You can reward them with positive rewards like hugs, kisses, candies, snacks and things like that. But yeah, so the thing that a lot of people don't know and a lot of people don't believe when we tell them is if your child is 2 years or older, they need to wear a mask.